Hi, I'm Patrice Jua, and today I'll be interviewing Amanda G. Ndorbor. She is the National Coordinator of the EVD Survivor Secretariat. Welcome, Amanda.
Thank you, Patrice.
So, Amanda, briefly describe the highlights of Liberia post-Ebola response.
Thank you. Our post-Ebola response look at active surveillance. It also highlights the referral pathways, which led to the active involvement of survivors' network into the ID and mapping processes. The formation of the network, having survivors come together under one organization called the Survivors Network of Liberia to ensure that engagement with survivors is maintained, hand hygiene, constant hand washing practices. And hand washing is simple, but it is one of the most effective ways of preventing disease transmission. The strengthening of the systems in the form of training of the healthcare workers on the survivors' clinical care guidelines, training of the service providers, especially mental health clinicians, refresher training on MHGAP, the infrastructure capacity building. Prior to the outbreak, most facilities didn't have triage system and no triage was built. But as we can see now, almost all of the facilities do have. So those are the highlights of our Ebola response.
Can you explain why the government prioritized system strengthening and survivor care?
From the assessment initially, it shows that there were a lot of weaknesses in our health system. And because of those weaknesses, the wave of the outbreak was what it was. So, prioritizing survivors' care and system strengthening with survivors' care, it helped to keep engaged with the survivors. That is to say, trying to prevent any possible transmission or resurgence of the disease, and with system strengthening component, looking at the infrastructure capacity, looking at human resource capacity, trainings, which will give the health providers the added knowledge to be able to effectively care for survivors while also keeping safe. And with the infrastructure piece, with those gaps that were identified, for instance, like the laboratories doing essential equipment, having them relook at help to create a more vibrant health system, preparing the system to be more resilient to face subsequent outbreaks.
What have been the major benefits of Liberia's chosen strategies?
The major benefits have been one, having survivors care integrated into the existing health system, having survivors identified by ID cards, which make them eligible for services that are intended for survivors. That is the piece on the survivors' care. With the system strengthening, it points towards sustainability because with infrastructure remodification and provision of essential equipment help to make the system more resilient. The system is more strengthened to be able to look and investigate issues that require laboratory analysis and other detailed tests. So with those ones, they've really been beneficial because with the project, the current program, the APC program that is supporting those pieces. As the program comes to an end shortly, the equipment and the modification renovations that have been done still to make the system more prepared for any further outbreaks. So that is very key because it is the sustainability component.
In your view, which ones have worked especially well and why?
In my opinion, what have worked very well has been the capacity building that targeted healthcare workers, giving them skills and knowledge, training on the clinical care guardians to make them comfortable and confident to care for survivors, and the infrastructure capacity building as well. And again, the reason is that those ones are actually what sustains the gains that have been made. And come the end of the program, those gains have been made. The facilities already have essential equipment and modern laboratories that have equipped them to be able to do a lot of tests that could not be done previously. And those tests and those gaps were identified initially as some of the reasons for which the outbreak was at the wave at which it occurred.
Is there anything you think the country should have done differently or sooner in the post Ebola response?
Yes, the country developed the Ebola survivors care and support policy, clearly outlining interventions and what are needed to be provided for survivors. So, with the development of such essential documents, it provides guidance on how to design and implement projects for survivors. It would have even been more essential to also highlight intersectorial collaboration at that point, and also highlight the establishment of the coordinating body that will be able to coordinate partners and other services that were intended for survivors.
What kind of help and or resources would be required?
For the intersectoral collaboration, having a coordinating body that coordinates all of those involved with survivors and survivors issue is one of the major resources, because with that coordinating bodies, services for survivors will be delivered in a coordinated manner, thus preventing the issue of duplication and making the best use of scarce resources.
Were there gaps in Liberia's programmatic response? If so, what are some of these gaps and why did they occur?
Yes, with the community engagement being sustained, with sustained community engagement, the response can be better because community will gain trust in services. Community then takes ownership of the intervention, and once community gain trust in whatever public health intervention, community respond to those interventions becomes increased. And with trust in the delivery of services, the utilization of services will also be high. So with slow community engagement was the gap. But if the community engagement is sustained, it makes community more comfortable to trust the workforce and trust the health facilities and make use of the facilities.
What do you believe are best practices for post Ebola response? In other words, what actions or activities should government prioritize?
This just takes me back to your previous question. Sustained community engagement was one of the best practices, and they should be prioritized because interventions are intended for communities. Services are intended to be utilized by the community, and the community wants to develop trust. Then they are comfortable to utilize the services that are provided for them. Community engagement, I'll say that.
Post Ebola support focused on survivors and health systems recovery. Was the balance right in Liberia? What might have been done differently?
Yes, the balance was right. You know, at the onset of the crisis and immediately after the outbreak, there were many partners providing support for survivors and also supporting line ministries. At that time, there wasn't a coordinating body that will coordinate all of those resources to ensure that services are not duplicated. So, with the creation of a coordinating body at that point, it will help to control and make sure services are not duplicated and resources are used wisely. On top of that, prioritizing intersectorial collaboration with all of the line ministries being actively involved with survivors' care, systems recovery, which includes both human capacity and infrastructure capacity, cuts across all of the line ministries. So, with that improvement, it is sustainable because when those capacities have been built, they remain.
If you had to highlight one action or activity as the most important strategy for a country's post outbreak response, what would it be and why?
I will highlight intersectorial collaboration between key stakeholders in line ministries of the government and sustain community engagement. Reason being that once the community is engaged and is kept engaged, they take ownership, they develop trust, and as community own the intervention, they actively participate and they make immense contribution to control of the outbreak.
Is there anything else you would like to share?
Oh yes, I'm happy to share the issue of government adapting programs that work during the response. With the adaptation of those programs at the period of transition, government, when they prioritize those interventions that have worked, transition is well planned for, and programs that are well transitioned tend to be sustained. So my last comment is prioritization of the transition plan where programs that work are kept and carried on by the government. I think that's my last comment to share.
Thank you for speaking with us, Amanda.
You're welcome, Patrice.
you.